Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today is National IV Nurse Day, okay? January 25th is the day set aside every year to honor and celebrate IV nurses specifically. So let me break it down for you. IV nurses specialize in giving intravenous infusions, meaning infusions that go directly into the vein and enter the bloodstream. So if you've ever been in a hospital, sometimes either you or yourself may have gotten, you or someone you know may have gotten an IV, but they may have also gotten IV fluids or IV medications. So most commonly, infusions that people know about include normal saline, which is given usually for hydration. But there are other things that can be given through an IV. And like I said, the things that people may be most familiar with being normal saline, that's something that is typically given in the ER, on the floors and things like that. But there are a ton of other IV infusions. And aside from saline, you can get electrolytes like potassium, sodium. Sodium's actually in normal saline, but you can get magnesium and other electrolytes that are important for bodily functions. You can get medications, which obviously you can get things like antibiotics in the ER or on the floor or by an IV nurse specifically. But you can also get many other medications like chemotherapy, things that are very specialized, and there are specialized nurses trained in these type of infusions. And again, that's what this video is about, celebrating and honoring IV nurses. So aside from medications, you can also get things like vitamins, okay? A lot of the times people, well, I shouldn't say a lot of the times, but sometimes people come into the ER, and typically it happens when someone is either they were very intoxicated or are intoxicated, or they are coming in after they drank a bunch and now they're having vomiting, dehydration, things like that, signs of alcohol poisoning. And in addition to getting saline intravenously, they may get things that we frequently call a banana bag, and that's basically a bag that contains multivitamins and mixture in there to basically replete some of the electrolytes and vitamins that may have been lost during all that vomiting. Okay, so aside from the fluids for hydration, the electrolyte repletions, the medications that you may receive, you also can receive blood products, okay, which includes whole blood, but more frequently it's given separated out, like red blood cells if you are having acute blood loss or you're having severe anemia. You can get things like fresh frozen plasma, or you can get platelet infusions. And again, when you're needing therapies or requiring large volumes of these products, you need a dedicated IV nurse because these things take time. And in addition to time, the IV nurse's specific role is not only to give you the correct infusion and monitor, they are responsible for giving you it at the correct dose, at the correct rate, and they're responsible for monitoring your response to that product. So they're looking at things like your vital signs, your heart rate, is it going up or down, your blood pressure, your respiratory rate, your oxygen saturation. They're looking at all these things, and they're also monitoring, at the site of infusion, are you having any irritation, any redness, any swelling, any signs of an allergic reaction? And overall, clinically and physically looking at the patient, talking to the patient, asking them how they're feeling, what is their response to the treatment that they are currently receiving. These are things that they are very experienced at picking up on, and at the same time they're educating their patients while their patients are receiving these infusions. And you know, when we give a patient a medication, a treatment, fluids, anything like that, anytime someone is given something, their body is going to have a reaction. And while we hope that they're having a good reaction to it, that's the whole point of giving them the treatment, we are monitoring to make sure they're not having an adverse reaction. And that is one of the job descriptions and important roles of an IV nurse, to look for these reactions. Now, it ain't all bad, okay? The point, like I said, is to have a good response to the infusion. And I'm just going to use red blood cells in this case, because in the ER, that's one of the most, in terms of blood, well, we give all the blood products, you know, red blood cells, platelets, plasma, but to highlight this point that I'm trying to make, when someone's either rapidly losing blood or they're having severe anemia, there are signs and symptoms that go along with that, okay? Blood, specifically red blood cells, have an oxygen carrying capacity, meaning that it has the capacity and job to carry oxygen to your vital organs. So someone who's either rapidly losing blood or someone who's having a severe anemia where their hemoglobin is low, they don't have a lot of red blood cells, their oxygen carrying capacity is very low. So they, in addition to feeling short of breath, they may feel weak, fatigued, tired, they may be having chest pain, headaches, all kind of things that go along with not getting enough oxygen to your vital organs. So during a blood transfusion where someone's getting red blood cells, at the start, they may be feeling very weak, very short of breath, very lethargic. And during the infusion, they may have a dramatic improvement. Why? Because now their organs are able to receive oxygen in a much more efficient and and in an adequate quantity or capacity. Their vital organs are now getting oxygen. So the IV nurse can also view that response. The patient's blood pressure may go up, you know, because before they weren't, you know, they either were lacking blood or lacking enough blood. And the person may start to feel a lot better, start to have complete resolution of their shortness of breath and all of the symptoms that went with the low hemoglobin. So that's one side of the coin. That is a good response. They're not always looking for some, you know, are you having an allergic reaction? I just wanted to point that out. And this is true for any other infusion that they may be given. They are looking for a good response or a bad response, or whatever the case may be. They are very in tune with their patient to see what exactly is happening when I give them this infusion. And this day, as I said, January 25th every year is a day where we take the time out to honor IV nurses that give infusions. So if you know an IV nurse, give them a hug, give them their love, give them their roses while they are here now, and just celebrate and honor them. If you learned anything in this video, or if you are an IV nurse or you know an IV nurse, hit that like button, subscribe to my channel, share this video with a friend, family member, or anyone that you love. If you have any comments or questions, you can put that in the comment section below. If you have any, you want to give suggestions for future Wonderful Wednesdays, because I do this every Wednesday. But if you have a specific question or a topic that you want me to highlight, whether it is about emergency medicine or health and wellness in general, mental health or physical health, put that in the comment section below and I can do a topic on that. But thank you for sharing this wonderful Wednesday with me. Be blessed and stay healthy.